Around 5,000 National Education and Health Allied Workers Union members have downed their tools. This despite striking a wage agreement with their employers at the National Health and Laboratory Services. The workers are protesting over corruption and demand a living wage. They say management is very poor and they have been raising the same issues for over 5 years. NHLS is tasked with providing diagnostic pathology services for government, such as blood tests. The union comprises of around 60% of the NHLS workforce. Nehawu and the Gauteng government recently reached a deal to end a strike by mortuary workers. That strike had resulted in bodies piling up, leaving bereaved families frustrated and unable to bury their loved ones.
We are fighting against corruption in the organization. We are fighting against a living wage. As we speak, we are speaking of management that is very poor, that is speaking the same language for over 5 years now. You can tell me if they are able to manage. How can they tell us the same reason for the very same request that we're making every year, that please give us a decent salary, a living wage? These are the bread and butter issues. And if we are unable to deal with those kind of issues, South Africans are victims of poverty. And as a result, we wake up every day, we save lives of South Africans, but we are getting nothing. We ask for 7.3%, they're giving us zero.
The members of the union decided to down tools after the negotiations reached a deadlock with the employer. We then went to the CCMA to try and resolve the dispute, which we could not, because at the time the employer had not put a reasonable offer on the table to counter our demand. This until we served the notice last week, but since we served the notice, the discussions have been until Monday. Monday late, we received a revised offer from the employer, which taking to members this morning as they are beginning the strike, and tomorrow we'll be reporting to members get Monday. Our employer has now put on the table is acceptable.
Outside at Sunningham at the National Health Laboratory Services, and this is when how members have gathered to show their anger towards their management. Some of the things they're complaining about is salaries, is the corruption that's happening in these offices, and it goes a bit further, them going into the National Department saying that they are worried with the National Department of Health, the way it's treating this certain operation and them not paying it in time, and thus this being a replication effect that comes to them and them having to bear the brunt of salary issues.